Just to quickly introduce myself, I'm Dr. Janina Albert-Maschke. I have a PhD in clinical psychology with a focus in ADHD, and I'm also a certified ADHD and executive function coach. My company is called ADHD Empowerment, and it's all about empowering everyone with ADHD or executive function challenges or ADHD-like symptoms. If you want to check out my website, you can do that under ADHDempowermentcoaching.com, or you can check out my Instagram under ADHD Empowerment Coaching. Before we get into the whole diagnostic process and the treatment plan, I want to make sure that we're all kind of on the same boat and that we know what ADHD is and what are these possible symptoms that we're looking for. ADHD is an acronym and it stands for Attention Deficit Hyperactivity Disorder. And as the name already entails, it consists of persistent patterns of inattention, hyperactivity, and impulsivity. And ADHD is a very complex disorder and it involves changes in brain chemistry. So our dopamine in the brain is lower versus a non-ADHD brain. And also it involves structural changes in the brain. So for example, our frontal lobe that might be smaller than in a non-ADHD brain. And that means that we might have difficulty making decisions or that we have difficulties regulating our emotions. And one important point that I want everyone to take home from this webinar is that ADHD is a legitimate medical condition. And if you have ADHD or your child or a family member has ADHD, it's not a personal flaw. That doesn't mean that they're lazy, and it's not a character weakness. So as I said, ADHD consists of these three main symptoms, and we kind of categorize them into three categories. So we look for hyperactive symptoms, we look for impulsive symptoms, and we look for inattentive symptoms. And what this hyperactivity can look like during the day-to-day is that maybe you or your child are constantly fidgeting, you might be tapping your hands or your feet, you might be moving around and feel like you're always on the go or you're driven by a motor, or you might be talking excessively. Impulsivity, on the other hand, can look like that you're have trouble waiting for a turn and it just seems impossible to wait, or you might be blurting out answers to questions that haven't even been completed yet, or you might be interrupting or intruding on other conversations and it feels like you're constantly butting into other conversations. For inattention, that might look like that you're having a very hard time paying close attention to details, or you might be making careless mistakes, or you're having trouble holding sustained attention on tasks or any activities. And maybe you're also constantly feel like you're losing stuff all over the place and you're forgetting stuff or forgetting any of your daily activities. Now, even if you are showing some of these symptoms or your child is showing some of these symptoms, it's important to note that this doesn't necessarily mean that you or your child have ADHD, because these symptoms can also be caused by other diseases. And that's why it's so important to seek out professional help and talk to a mental health professional and ask for their opinion and ask for their examination and diagnosis. Now, if you think that you might have ADHD or your child or family member has ADHD, here are some people you could go to get diagnosed and ask for help. Depending on the age, you could go to a pediatrician, you could go to a psychologist, a psychiatrist, or an advanced practice registered nurse. Here, it's always important to ask if they can diagnose ADHD in children or in adults, because that might depend on the practitioner, and also ask for if they are specialized in ADHD. And once you found that healthcare professional that you want to go to and seek a diagnosis, you might be wondering what a diagnosis even looks like and what's involved in this whole process. And there are a lot of steps involved that you can see here. It's usually start with the DSM-5. That's a questionnaire and it stands for Diagnostic and Statistic Manual of Mental Disorders, and it's just the 5th edition. There's always a more recent one coming out. And here, the healthcare professional would look into if a patient has at least 6 symptoms of the 9 present in either inattention, hyperactivity, or impulsivity. And these symptoms have to be present before the age of 12. And these symptoms also have to interfere or reduce the quality of your social life or of academic or occupational functioning. A healthcare professional would also conduct a clinical interview, and in this clinical interview, you are usually asked about your daily functioning, about your family's psychiatric history, what's your current mood, what's your sleep pattern, what's your overall physical development or health and appetite, food intake, and so on. The next step then would be to look into or conduct a normed rating scale. And here, again, the healthcare professional would ask you a lot of questions. They would look into the recent month and the recent years. Have there been any drastic changes in your life that might have caused these symptoms to appear? Then they would also probably conduct a physical exam. So they would look into your medical history. Do you have any medical problems maybe? Do you have maybe thyroid issues that are causing these symptoms? And then they would also probably look into learning disabilities. So for example, do you maybe have dyslexia or dyscalculia? And then go from there. After that, they would also look into comorbid conditions like anxiety, depression, or substance abuse disorders, because these comorbid conditions or these other disorders can also cause ADHD-like symptoms. And once all of these testings are done and you now might have your ADHD diagnosis, your healthcare professional might even be more specific on what subtype of ADHD you have, because ADHD is also split into 3 different subtypes. So there's first the combined presentation. That means that you display all the symptoms. So you have inattentive symptoms, you have impulsive symptoms, and you also have hyperactive symptoms. Then the second subtype would be predominantly inattentive presentation. So that means that you are mainly just inattentive, but you don't have that much of the hyperactive or impulsive symptoms. And then the last subtype of ADHD is predominantly hyperactive or impulsive. And that again means that you're mainly hyperactive or impulsive, but you do not display these inattentive symptoms. Funnily enough, when we think about ADHD, we often think of that hyperactive child that is running around in the classroom. So we probably think, or most people think, that the predominantly hyperactive or impulsive presentation is the most common subtype of ADHD, but actually it's the combined presentation, and then the second most common one is the predominantly inattentive presentation. So now that you have your diagnosis and maybe even have that ADHD subtype, you might be wondering, what is the best treatment for you? And because everyone is very different and it depends on, firstly, the ADHD subtype you have, on your life circumstances, on if you're a child, adolescent, or adult, this can vary greatly. However, research has shown that a comprehensive treatment approach that includes a lot of different treatments is the best approach and has shown the best effects. And the possible treatments that are available right now is medication, different behavioral interventions, accommodations in the classroom or at work, as well as lifestyle changes. For medication, the 2 types of medications that can be prescribed are stimulants or non-stimulants. Mostly, first line is always a stimulant medication, and then you can either get prescribed medication like Ritalin or something like Adderall, which is an amphetamine. They have similar effects where they increase the availability of dopamine in your brain. But Adderall has an additional effect where they also make sure that you don't take up the dopamine that is produced in your brain too quickly. because we ADHDers, we're not only low on dopamine, but we also love to take up the dopamine very quickly and metabolize it very quickly. Then for non-stimulant medication, one common medication is Strattera, and non-stimulant medication works in a similar way to stimulant medication, but it just takes a longer time for us to see the effect. So we would have to take it for a couple of weeks to actually see any changes or a benefit. And that's why stimulant medication is usually the first route that physicians take. However, if the side effects are too severe, then a non-stimulant medication would also be a possibility. Now, can everyone take ADHD medication? As we all know, medication, also ADHD medication, can have side effects, and the most severe side effects can be that you are not hungry anymore, so you might lose weight. So if you have a low BMI, you are probably not getting prescribed stimulant medication. Or if you have substance abuse problems in the past or are currently having them, you're probably also not getting prescribed stimulant medication. Or if you have heart problems, you're also not getting prescribed stimulant medication, as stimulant medication can increase your blood pressure and your heart rate. So some possible questions you could ask your doctor if you're wanting to start ADHD medication or starting ADHD medication or just wondering about ADHD medication and if that would be a good treatment option for you. You could ask firstly about what are the possible side effects of each medication. Would a short or long-acting medication be better for me and my lifestyle? Because the short-acting medication would be in your system for about 4 hours, whereas the long-acting medication would be in your system for about 8 hours. Then another important question would be, what is the doses of the medication? And again, that kind of depends on short and long acting. If it's short acting, should I take 2 doses spread over the day, or should I just stick to 1? And also one important thing you could ask your doctor if you haven't already gotten a health check during the diagnostic process is to ask for a health check to get just a full blood work done, check your height again, your weight, as well as blood pressure, because as I just mentioned, it can decrease your appetite, so you might lose weight. And also if you have heart issues, taking stimulant medication is just not recommended. Another treatment option would be ADHD coaching. And ADHD coaching would provide personalized support and guidance for individuals with ADHD. And the great thing about coaching is that we coaches specialize in working with clients to develop strategies, improve executive functioning skills, and also enhance overall well-being. And I, or also other ADHD coaches, we focus during each session to set certain goals. So we will look into maybe improving time management if that's a big struggle for you, or we look into organization and self-regulating skills. And we also provide accountability, motivation, and additional practice tools that are really tailored to you and your individual needs. And coaching can be a treatment that you either do on top of medication, or you could try coaching just by itself and then try medication later. And the great thing about coaching is that it works for everyone. It works for all ages. It works depending on no matter where you are kind of in life. Whereas for medication, as I said, depending on your BMI or heart problems or other health issues, so you might not be eligible to take stimulant medication. Coaching really works for everyone. Apart from the medication and the coaching, another thing is you could ask for accommodations. And here again, what accommodations you ask for kind of depends on where you are in life and if you're either working or if you're in school or in uni. But in general, what it can be helpful is asking for preferential seating, maybe sitting in a more quiet area or more like less distractible area, maybe away from the windows, then using a graphic organizer can be also a great tool to use, because a lot of ADHDers love just using something visual and maybe crossing something off. If you're in school or in college, you can also ask for extended time on tests. That can be very helpful. You can also ask to preview or review important information. And in school, and sometimes some colleges provide that as well, you can also ask for assistance from an aide. Another great tool that you could use is noise canceling headphones that can just cancel out all the noise that may be distracting to you, and then using fidget toys. And here I posted 2 possible fidget toys, but there's a plethora of different fidget toys out there. But the first one, it's called Calm Strips. And I often recommend that to my students who want to take something into class that isn't loud. And sometimes some teachers don't allow you to take in any fidget toys for whatever reason. So you could even glue that calm strip to the bottom of your desk, which is really great. And then no one will even notice that you have that. Or on the bottom one, that's also a very quiet fidget toy. Another important treatment aspect for ADHD is just overall lifestyle changes, because lifestyle changes can just complement all the other treatments that you are doing and contribute to an overall better management of your ADHD symptoms. And one great lifestyle change is maybe incorporating exercise, because exercise can not only reduce hyperactivity and improve focus and mood, it also increases all our happy hormones, so dopamine, norepinephrine, and serotonin. And these are all hormones that unfortunately we ADHDers are very low in. So incorporating exercise can be a great tool. And I know exercise isn't always for everyone. A lot of my clients come to me and are like, Janina, I can't exercise. I hate running. I don't want to do it. But the great thing is that there is a plethora of different exercises out there that you can try. And you don't have to be a long distance runner to exercise or to enjoy exercise. You can try Pilates, you can try yoga, you can just go for daily walks, you can invest in a standing desk and just stand and while you're working, for example, or you can put some light weights next to your desk and use them every couple of hours. Just getting in that movement is really great, and research has shown that bouncing a ball for just 15 minutes can already increase concentration. Another great thing to really take care of or incorporate is getting in adequate sleep. That is crucial for everyone, but especially for us ADHDers, as it enhances cognitive functioning, attention, and just overall well-being. So making sure that maybe you have a good nighttime routine and that you get to bed at kind of the same time and get up during the same time can be very beneficial. Also, again, having a balanced diet that kind of applies to everyone, but again, especially for ADHD, that can be great. Having a nutritious diet, eating complex carbohydrates, proteins, fats, just making sure that you fuel your body so you have that energy, that can also really do wonders for your ADHD symptoms. Practicing mindfulness is also another great thing that we can start to incorporate, and that can really help a lot of ADHDers. And this can also help a lot if you're feeling a lot of stress or a lot of anxiety and just in general worries, or are struggling with emotional regulation. Incorporating some mindfulness practices can be very helpful. And here again, this doesn't have to be just meditating and sitting there for 10, 20, 30 minutes, because I know that can be hard for a lot of us ADHDers, and especially in the beginning. You could just start off by maybe doing walking meditation. So there's just a lot of options out there, and you just have to find the best fit for you. So as you can see, there's quite a lot of treatment options out there. And here again, it's best if you kind of think about what are your strengths, what are your unique challenges and needs, and what would fit best for me personally. And if you're interested in getting even more like ADHD resources and guidelines, you can download my free ADHD resource guide on my website. And in this resource guide, you can find again some self-tests you could do, or your children, just to see, might this be ADHD or might this be something else? It includes some great ADHD books, some, again, fidget toys that I really like or my clients really liked. And again, it just summarizes again all the treatment options that I just talked about. And now I'm open to any questions that you might have. And just again, if you're interested in ADHD coaching or just want to talk to me and get some more resources or help, you can either email me at adhdempowermentcoaching@gmail.com, or you can check out my Instagram, which is ADHD Empowerment Coaching.
Thank you very much. I appreciate the presentation. That was very, very good. One of the first questions that I have for you is, what's the role of a mental health professional versus an ADHD coach when it comes to a comprehensive treatment plan for an individual with ADHD? Which, when someone goes to a mental health professional, what role do they play and what does a coach do?
Mm-hmm. So if you would go to a mental health professional, you would either seek out a diagnosis or medication. An ADHD coach wouldn't be able to either diagnose you or prescribe to you ADHD medication. And also then there's a psychologist could give you therapy, versus an ADHD coach would do coaching. And coaching is really more learning how to function on the day-to-day basis, how to improve your executive functioning skills. How can I learn to come on time? How can I make sure that I don't forget everything, that I don't forget my homework? How can I make sure that I get my room cleaned? What are some great tools that I could use there? Or how can I make decisions? Because that can also be very difficult for ADHDers. And that's like what an ADHD coach would do. It's really trying to learn how to function on the day-to-day. And then with an ADHD coach, or at least what I do, is that for my clients, they all kind of learn and build their own little ADHD toolbox that they can also use once the coaching relationship ended. And then they always have this toolbox available that they can always use and pull out certain tools that they might need in certain situations.
Great, thank you. And do you have any recommendations on how an individual can, either for themselves or for their children, find a qualified mental health professional who would diagnose and treat, and or a coach?
Mm-hmm. So for diagnosis, it really depends like where you live. I always recommend that you just go either on Psychology Today or Google your area and who is around, what psychiatrists or psychologists are in your area and can diagnose. And then you can always look at their maybe Google ratings or on Psychology Today on their ratings and reviews and see if they might be a good fit. And then for coaching, you can reach out to me, of course. You can also just go on social media and look who is a coach. You can also go on ACO, which is lists all the certified ADHD coaches, which I find really great because it's always important that you look for the qualifications of an ADHD coach and that they had the training that they actually need to be a qualified professional in their field.
Thank you. The next couple of questions relates to adults with ADHD and diagnosis. How is the diagnostic criteria different and/or the process for being diagnosed as an adult different than for children?
For being diagnosed as an adult, you would probably do less testing. For children, sometimes they have some more like cognitive tests or impulsivity tests, whereas in adults, most practitioners would not do that. And also for like, obviously, if you're a child, your parents would come in and then your parents are also being interviewed and questioned. And in adults, that doesn't happen. Sometimes you get a questionnaire to take home and to give to your parents or even old teachers. But in most cases, as an adult, just you will receive the interview and the questions.
Thank you. The next question relates to ADHD and co-occurring conditions. The first one is with thyroid conditions. The person was asking if the person has both ADHD and thyroid conditions, what does that look like?
So having issues with thyroid can cause similar symptoms like some of these ADHD symptoms. That's why it's always important to get your the medical health check and get your thyroid checked to make sure that maybe this can't originates from your thyroid, and if so, then it could be easily helped with medication, versus if everything is cleared and you don't have any of these issues, then you kind of know it's definitely from ADHD, and these symptoms are definitely are originated from ADHD, and then you know, okay, now I just have to treat ADHD.
Thank you. The next question relates to substance use disorder. The person said that you spoke of reasons for stimulants not being prescribed to certain individuals. You mentioned heart problems, low BMI, and substance use disorder. When speaking of individuals with addiction, do you mean all addictions or only persons with specific addictions that should not be prescribed medications? So, for example, alcohol use disorder.
So in most cases, if you have any substance abuse or misuse disorder, you don't get prescribed stimulant medication because stimulant medication is a class 2 drug, it can be very addicting, and that's why most practitioners would not, or doctors would not, prescribe it to someone with substance abuse disorders. If you had an addiction to exercise or food, then that would be something else. It's just mainly for substance misuse.
Thank you. Can you speak about the effectiveness of non-stimulant versus stimulants?
So for stimulant medication, you would see the effect pretty much immediately as soon as you take it, or like an hour or half an hour later, versus for non-stimulant medication, you would need to take it consistently for a couple of weeks to see the effect. And then once you've actually seen the effect and you don't have any side effects, then it would have a similar mechanism and you would show similar results to a stimulant medication, but it just takes much longer.
Thank you. This person was asking, when making a diagnosis, what are some ways that professionals may distinguish whether it's ADHD versus another disorder or condition, or maybe more than one?
Mm-hmm. And they find that out through all these interviews that they're conducting, like, for example, the clinical interview or the DSM-5 diagnostic criteria, where they would also ask you questions and kind of distinguish, is this maybe depression? Is this anxiety or bipolar disorder, or is this ADHD? And that's why it's such a long process to get diagnosed, because they just want to make sure that they diagnose you obviously with the correct disorder so you can receive the correct treatment and actually see the success.
A person is asking if you have any resources or recommendations for a person who may be married or have a partner with ADHD.
In my ADHD resource guide, you will also find books that are really helpful for relationships or marriage that I also recommended to a lot of my clients. I also post, have like always a questionnaire on my Instagram profile where I answer questions related to all the ADHD topics, but also specifically relationships, because that's what a lot of people wonder about. And I also post a lot of content about ADHD and relationships, because that's, again, we all kind of want to have a partner, and with ADHD it's just very difficult. So I always get a lot of questions about it. So I also make sure that I post a lot about it and answer all of your questions.
That's great. Thank you. Going back to, again, diagnosis, can you mention some of the standardized tests that maybe professionals use when they are diagnosing someone with ADHD?
Mm-hmm. So it's listed here. So here, this is usually what the diagnostic process looks like. And then it really depends from country to country on what specific tests you might be using. Sometimes for the clinical interview, that mainly depends on the country or sometimes even the state where you're located and the practitioner, what tests they prefer.
Thank you. The next question relates to symptoms. Is it difficult for people who have ADHD to make friends or have good relationships with others?
It can be very difficult for some, because we have not only issues with regulating our emotions, so maybe we will get very angry one day and then very sad the other day, which can affect a relationship, friendship, whatever. Also, our impulsivity, sometimes we might blurt out certain things we didn't mean to say, or it might seem that we are not listening to our partner or to a friend. Or when we're stuck in hyperfocus mode, we might totally forget about our partner or about our friends or family members and totally forget to message them back or respond to them or listen to them. So all these symptoms can make it very difficult for a lot of ADHDers to have a good relationship or with their partner or friends. And that's why it's so important to get treatment and to get not only medication treatment, but also coaching or therapy, because that can really help you a lot to get better with these relationships and forming them and keeping them.
Thank you. We have a number of women that are joining us today, and they are curious about the difference between the symptoms when you are a woman with ADHD, and also in particular when you are perimenopausal or during menopause. So can you share some information about that?
Mm-hmm, of course. So for women in general, ADHD is the same disorder no matter what gender you are, just due to societal norms, stereotypes. A lot of women have masked their symptoms for much longer. And then also on top of that, our menstrual cycle can make our ADHD symptoms much worse depending on where we are in our cycle. So just before our period, our estrogen drops, our progesterone rises. That means, again, our dopamine drops even more, making ADHD symptoms much worse. And then the same for menopause. And once you're in menopause, again, estrogen drops drastically, and that just increases your ADHD symptoms. And that's why a lot of women, or a lot of my clients now, are in their 60s and just got their ADHD diagnosis and are now starting to work with me because they only now notice that they have ADHD because their symptoms got so much worse after menopause.
Thank you. And now we're going to the younger children. Do ADHD symptoms present in preschoolers any different than when they reach school age, kindergarten and up?
Mm-hmm. So in general, you wouldn't diagnose ADHD before the age of 7, or it's not, I guess, recommended because it's hard to differentiate what's just a preschooler doing or is that ADHD symptoms. And also in school, it's just a different environment as well. You have to sit still for a long time. You have to learn, you have to do certain things in certain structures. And that's also when a lot of these ADHD symptoms just really come to show. And that's when a lot of people or children start to get their diagnosis. And before that, again, most people wouldn't get an ADHD diagnosis.
Can you speak about when people may be having changes in life that are affecting the effectiveness of their medication? So for some reason, their medication just doesn't seem to be working anymore. Do you have any thoughts or comments about that?
So for women, that's something I see a lot in my clients is either, again, before their period starts or then during menopause, because then during that time, they would probably benefit from a higher doses just because their ADHD symptoms become much worse. For others, it can also be that they might become kind of tolerant to their ADHD medication. So sometimes increasing the dose can be helpful, or switching to another type of stimulant medication or non-stimulant medication can also be helpful in these situations. And also during these situations, it's always best to talk to your healthcare professional, to your doctor or GP.
Okay, we have one more question here. The person that asked the question is concerned about addiction to these medications. Can you address that issue, please?
Mm-hmm, of course. So there have been quite a lot of studies about addiction and stimulant medication. And for ADHDers who take stimulant medication, they have not seen a link that they are getting addicted to stimulant medication. And actually, in the long run, they've seen that individuals with ADHD who are taking stimulant medication are less likely to have any type of substance abuse disorder in their later life. And on the other hand, if an individual with ADHD doesn't take ADHD medication and in general doesn't have any ADHD treatment, they're more likely to get a substance abuse disorder.
Thank you. All right, that is all of our questions for today. Do you have any final thoughts or comments before we wrap up for today?
Just if anyone has any more questions, they can always reach out to me via my email, my Instagram, or the contact form that I posted into the chat. And also just what I said when I started the presentation, it's important to know that ADHD is a medical disorder and that it really isn't a character flaw, or that you or your child that aren't lazy, and they're probably trying their best, but they just need to find a way that works best for them and find their own tools and strategies that works for them to feel empowered and to thrive in life.
Thank you. That's great. That's wonderful advice. Well, thank you so much for your time today. It was very informative, and I'm sure that everybody who is attending is very grateful for all of the information and knowledge that you shared today. So I just wanted to thank everybody who joined us today, and ask before you leave to please complete the online survey, excuse me. That would be greatly appreciated, and hopefully you'll join us for our next webinar. So thank you, everybody. Have a great afternoon, and we'll see you next time.
Thank you. Bye.
Bye.